Hello, this is David Kettlewell with Medical Matters because Life Matters. This is an unusual show. We're going to be talking about solutions to America's healthcare challenges in the global picture. It's a fascinating perspective. Be right back. Hi, we're talking today with Phil Haberstro from the Wellness Institute of Greater Buffalo. Now, here's what we're not talking about today. We're not talking from the hospital perspective. We're not talking from the drug company perspective. We're not talking from the physician perspective. These are the vested players in the medical establishment. This is also not the government perspective. What we are talking about is a global view of care in this community and across the country, trying to figure out what really will move the health of America's people forward in a positive way. Talking with Phil Haberstro. Welcome to the show.
David, I'm so pleased to be here. Thank you.
Now, you're trying to figure out what's going to work in America when it comes to health. Define what that means.
Well, I think, David, we've realized what works, to be honest. And the real challenge is to get the community buy-in to new strategic approaches that will create health in communities.
Let's help the public understand what you do. Define something that's existed in the past that's problematic and how you thought through some kind of a solution and helped to get it implemented so they can see how your organization that's a nonprofit, 501c3,
Sure.
gets in there and changes things.
Right. I'm going to use two examples for you.
Okay.
One, I'm going to talk about community involvement. And one of the things that the Institute did is we worked with the National Civic League, which is a national organization that's concerned about the health of the American democracy. And so we've learned and gained skills in how you create change in communities. Communities that want to move forward need to know first where they're at. That's their current reality. The second thing, Dave, they really need to have is a vision for their future.
Are you saying that in aggregate, that American communities like Buffalo, that what's happening with the medical system in total, even though it makes sense on an incremental basis, this entity does this, entity does this, that there's another perspective needed to really optimize health in the community? Is that what you're saying?
Absolutely. And let me say it this way. Let's balance the scales. Right now, we spend, as you probably have articulated in your show, over $2 trillion. I don't know how many zeros are in that annually, and that number's only going to grow. But most of that, 95% of what I see in the literature say, Dave says, 95% is spent on treatment and cure. We need to get more investment in prevention and health promotion if we're going to improve the health status of the citizens in our communities.
So what you're saying is that the solutions to America's challenges aren't necessarily solely in the province of better technology, more hospitals, more physicians, that there's some other things that we need to do as a society. Like what?
Well, let's talk about society for a second, then I'll get to some specifics for you. What are the drivers in the marketplace? Let's take right now...
Money.
Well, that's...
I shouldn't have said that.
No, that's an important piece, and I'm glad you brought that up. But let's just look at the marketplace in any community in America. I can identify three critical elements that any community should be paying attention to. First is the childhood overweight and inactivity crisis, which is leading to a huge increase in childhood obesity.
Well, why is that problematic? You're knowledgeable. Let's tell the people.
Well, first thing is what's going to happen there is, and it's already happening, you're going to get more young people with type 2 diabetes. Now let's go to your money equation. Let's say instead of adult onset diabetes, diabetes comes on at age 15 instead of age 60. Okay.
They don't even call it adult onset diabetes anymore. Now it's type 2,
right,
because it's in the kids too.
Right, but look at the cost of that. If you look at the cost, it's probably somewhere $14,000 to $15,000 a year to treat diabetes. If we can prevent that, if we can keep our children more active, eating better, through our schools, through our after-school programs, we're going to save America tons of money. Second place in the marketplace, adults, but particularly employers. Employers have huge concerns in all sectors, public, private, nonprofit sectors, for the rise of healthcare costs. So you've seen the increase in the number of employers.
Making America less competitive worldwide.
Absolutely. But there's a solution to that. Worksite health promotion, employee wellness programs. New York State has a tremendous program called Healthy Heart, where we focus on going into workplaces and assessing the environmental support for health in those workplaces. Third place in the marketplace, Dave, huge. With all due respect to you and I, we're going to be heading into our golden years pretty soon.
Yeah.
The aging population issue, and the number one concern of the people in that market is their health status. So if you look across America, and you look across, let's take Buffalo, children, adults, older adults, there's a systems approach here that's needed to creating health in communities.
Outside of the pre-existing treatment organizations. In other words, it's kind of a given that a surgical clinic focuses in all their strategy and all their thinking on surgery, doing more of it, more profitably, and providing better service. But what you're saying is that a nonprofit is helpful, like the one that you have, the Wellness Institute, because you take a look and say, well, wait a second now, it's not just the qualities of the surgeries we're doing. Let's try and have people need fewer surgeries because maybe they're eating better and they're exercising more, or at least pushing health in a positive way by doing those things. Question, what do you think that the public's number one concern is with medicine in America today, in your opinion? Then I'm going to answer the question, because I've got an idea on that too.
My sense of that is probably the cost for most of America. There will be a certain part of American population, of course, that is concerned about the access thing. But I think by and large, because if you look at the cost parameters, whether you have some form of insurance or not, when the crisis comes, yes, you want the best medical system there for you. So I think that that's probably on top. Usually when we look at employer surveys, David, the healthcare costs for employers is either number one, number two, right in the top three in their concerns. Well,
General Motors has said that the reason that their cars are not as competitively priced as some others is the high cost of medical care for their employees.
Right.
So it's actually becoming a force in America that's holding us back from world competition.
And let's go another way. We talked about the aging population, Medicare, and those programs. Fortunately, the good news is recent legislation just passed has improved the number of preventive services that are available through Medicare. But all of us, you and I and all the viewers of our show today, pay taxes. And so if we don't reduce, again, those things that we can to change those behaviors that we can. Let me give you a powerful example here in America, and I'm going to apply this strategically. In 1964, the U.S. Surgeon General released the first ever report on tobacco and health. Okay. Strategically, if you're going to change a culture in a community and move it forward, you need 5 critical elements. You need to look at public policy. You need to look at the environments that people live and work and play in. You've got to look at community capacity, you've got to have programs, and you've got to reorient that sickness care system towards prevention. In '64, 50%, approximately 50%, 1 in 2 of the adult population were smokers. We're now down to 1 in 5 in New York State.
Well, it's 22% nationwide.
Yeah.
22%.
So we cut that down over that time. How did we do that? Did we do it with more education? That helped. But if you look at public policy, here in New York State, we just celebrated, you're going to have later in one of your shows, I understand, our terrific county community-wide tobacco coalition. We just celebrated 5 years in New York State of a smoke-free New York State. That public policy piece had a lot to do with that. Same with building community capacity. We have a terrific coalition here in Western New York that works day in and day out to keep tobacco use.
Well, what we're saying, and this is a real simple concept, smoking cigarettes does almost indescribable damage to public health. Now today it's 22%, or about 1 in 5 Americans smoke cigarettes. I had a show that we did a couple years ago, and I had 3 respiratory therapists there. People that worked with liquid oxygen and oxygen systems. They were talking about lung disease. And I said, what percentage of the patients that you work with in your practice were cigarette smokers? The patients that have chronic lung disease, emphysema, small cell carcinoma, or lung cancer. For more Medical Matters television shows, go online to medicalmatters.tv.